Also need someone who can help me. You understand?
On January 26, 2009, Angela Nsimbi, now a mental health activist, stood under a mango tree between the convalescent ward and the women's ward at Butabika National Referral Mental Hospital. She held her baby tightly to her chest.
I was looking at these women, saliva dripping, hair is cut off, they are in green uniforms, they are putting their hands groping those big grills of the fencing. In my mind I'm thinking, Angela, man, I might not be well, but man, I'm not this bad.
A few days earlier, the 50-year-old mother of 5, who was a journalist at the time, had suffered a mental breakdown. The 9-month-old baby she was carrying was her 4th child.
I was raised in a polygamous family, in a family with a lot of tensions, a lot of pain, and somehow when you're growing up, you just cover it up. So it was a combination. I'm working full time, you're a wife, you're a mom, and with my also emotional baggage, I just couldn't cope.
Nsimbi broke down in a manic episode that was eventually diagnosed as bipolar affective disorder.
I was speaking rapidly. I'm sure even when you Google that, it's one of the symptoms. And mainly I was talking about pain. The pain, things I have had to deal with, and I could not take it anymore. Because I remember I took the whole day.
She took 7 months off work to recover. Luckily, she was a freelancer and her sister was her supervisor. While her triggers were issues outside her workplace, other employees have had to deal with mental health issues triggered by conditions in their workspaces. Derek Chizambuga, the executive director of Mental Health Uganda, says the COVID-19 induced lockdowns and the government policies on isolation brought to the fore the social and psychological problems that employees were dealing with.
Many employers approached us to try and advise on how you can integrate mental health in the workplace. These included banks, but also private businesses.
Mbuga adds that toxicity in a workplace is relative, although it does not take much for a work environment to become toxic.
Leave is very restricted. For instance, you don't take breaks. When you fall sick, then you are falling sick too much. There's no health insurance, but there could also be abuse.
Last year, a study conducted by Makerere University School of Public Health and Butabika Hospital and released by the Ministry of Health found that 1 in 3 Ugandans is struggling with poor mental health. Vivian Kuda, a clinical psychologist with Minders Wellness and Psychological Center, says that while more men are committing suicide, more women are attempting to and failing.
So if I am HR at work and I capture, say, 10 people came for mental health support, where do I send that information for? So we don't have those systems, and they make planning difficult. They make interventions challenging.
Increasingly, the blame for toxic work environments is being placed on the uncaring attitude of the Human Resource or HR department. However, Ronald Bossa, the president of the Human Resource Managers Association of Uganda, argues that HR is a strategic partner, a change champion, an administrative expert of the business, and not a counselor.
The responsibility for mental health should be a responsibility of everybody who gets results through others. At the end of the day, HR will never be able to play their strategic role for the whole business if you reduce the contribution of HR professionals to welfare.
When we go to workplaces to create awareness on mental health, you find senior management is missing. You find the board is missing. And these are influential people. These are people who have both power and influence. If you don't have their buy-in, then there's so little you can do.
However, given the physical, social, and psychosocial dimensions of mental health, Mbuga says that integrating mental well-being into an organization's culture is necessary.
So you need to create a kind of a policy, to create an environment where people can speak up, for instance, when they are not well. If you have people who have declared that I have a mental health problem, for instance, then you have to design a tool for reasonable accommodation.
The question about why insurance companies rarely integrate mental health care into their package remains.
Insurance is negotiation, so you need to negotiate toughly. So if you don't have this in the package, then I am likely not able to. So you negotiate that from the word go.
There is a general assumption, though, that mental health problems can only be fixed by access to medication, yet a more holistic approach is needed, especially if the mental health triggers are social in nature. While there are almost no statistics on how much Uganda loses every year due to poor mental health, statistics show that individuals with mental illnesses are likely to drop out of school or work, heavily compromising the country's human resource.